I remember as an SHO sitting opposite this registrar, who this was up in Leeds, a bit older than me, and he said, we were having lunch, and he sort of said, well, Viv, what are you thinking of doing? And I said, well, kind of actually thinking I want to do cardiology. And kind of laughed and was like, you can't do cardiology though, can you? And I was like, oh, why? And he was like, well, because you're a woman, you're a girl like this. I didn't care enough about his opinion to worry too much, but it stuck with me. It stuck with me that he stated overtly, well, you can't do cardiology because you're a woman. And I was like, well, that just makes, and I even said, that just makes me want to do it even more. If somebody tells me I can't do something, I'm definitely going to do it. My name's Viv Ezzat. I work at St Bartholomew's Hospital at the Bart's Heart Centre there, and I'm an electrophysiologist, a consultant electrophysiologist and cardiologist. And I knew from when I was about 5 that I wanted to be a doctor. Basically, I graduated medical school, did the usual round of house jobs, and as part of my house job rotation, at this point I wanted to be a paediatrician. I thought I wanted to look after kids. Part of the just standard rotation was going through cardiology block, and I was like, wow, this is really fun, this is really cool. You actually get to do stuff. You can literally in front of you see what you're doing, making a difference, changing somebody's health from being, coming through the door almost dead to suddenly sitting up, having, a cup of tea. So I came down, I did my PhD. I dragged myself through that. I'm not going to lie, it was a challenge. I'm really proud of having my PhD. I was the first female electrophysiologist. I was the first interventional female cardiologist of any description at Bart's, coronary or structural or EP. So I employed a female colleague who joined the team as congenital electrophysiologist. I've employed a full-time nurse, full-time secretary. These were all things that we didn't have, and I had to fight very hard to get them. I'm aware anecdotally that when I was appointed in 2015, when I started in 2015, I'm pretty sure I could count on 2 hands the other female electrophysiologists that I knew in the country. I'd be surprised if even 10% of the electrophysiologists in the country are women. There's a 2005 BJCA survey that showed, I think, about a quarter of trainees express an interest in doing cardiology when they're more junior, but then by the time it gets up to the training level, it's more in the sort of 15-20% range, and then by the time you get to the consultant level, it's sort of less than 10% in cardiology, purely cardiology. And I think the numbers have improved a bit. I think the most recent data was from 2019, and they sort of, each of those had gone up by a couple of percentages. But if you then if you delve into that and look at where are those women in cardiology, they're in the non-interventional specialties largely. So they're in the chest pain clinics or imaging or heart failure or congenital heart disease. They're not doing coronary intervention, they're not doing structural intervention, they're not doing electrophysiology. They're not doing the specialties that involve being in a lab, actually physically intervening on patients, doing procedures. They're not in those specialties. I never thought of myself as a female mentor or a female advocate or a role model, and that might sound really stupid, but I just hadn't, and I think part of the reason I hadn't is because I hadn't had them. So I didn't recognise that I was until probably the last 3 or 4 years, where women have actively taken me aside or come up to me and gone, like, I just think it's amazing, or I'm so happy, it's so interesting, it's been great to meet. And then I suddenly started going, oh shit, I've got a responsibility here. Like, I was doing it all informally or casually, but not consciously. I really love the part where I see the patient afterwards and they walk in and they are so much more well. Or the part where a patient tells me that they were really, really nervous about the procedure, they were really, really scared, and I made the whole thing so much easier for them. I'm very aware of that. I talk about that openly with colleagues a lot, that real pleasure and joy and satisfaction of getting to look after people and that privilege. And I just don't know if, because I feel like sometimes on the more male side, like it's so focused around the procedure, it's so focused around that problem solving, which is key. Like, if you don't have a successful procedure, arguably if they have a good experience, does that really matter? But I think that side of things, I think, is perhaps something that I feel I'm more blessed in because I'm a woman.